right. John Poole is excused tonight. And other than that, everyone is here from the committee.
No.
No,
They're not
I'm
here.
just gonna put absent then.
Mm-hmm.
All right, both are.
Be sending them an email.
Yeah. Okay, so let's begin. Call to order at 6 o'clock. Any citizen comments? Any citizen comments tonight? Citizen comments? Okay, citizens' comments are closed. Do anyone in the committee have anything they would like to say? Yes?
In
Supervisor Brown?
absentia, I would love to thank John Poole for the suggestion that we go see kids and for
Yeah.
that visit at the care center. And I'll make arrangements to see some of these other folks.
Okay, yeah, I think, and we don't have to go as a group.
No,
We can
right,
go
right.
anytime you want, just tell them who
Right.
you are.
That's
and, you
easier
know.
for them though.
Yeah, I know, so they don't have to do 5, 6, 7 different,
Yeah.
yeah.
Okay.
But yeah, no, that sounds like a plan.
Thank you.
Anybody else? The visit to the new human resources building, still
good.
underway, was good.
Mhm.
You weren't able to make it.
Yeah. That was good.
It's got another good year before it finishes, but it's making progress. Maybe more. Okay, well, I was told by Mr. Molinaro that it would be about a year. So I'm just passing on what was told to me. Now, whether that actually comes to
Yeah.
fruition, remains to be seen. But anyway, it was good to see the work that they've accomplished so far, so. So no other comments? Okay. Approval of the minutes from June 3rd, 2025. Has everyone in the committee had an opportunity to look at the minutes from last month? I believe everyone was here. Okay, we have a
Second.
first by Supervisor Kirby, a second by Supervisor Brown. All those in favor, say aye. Aye. Opposed? Okay, motion carries. The minutes are approved from June 3rd. Okay, next we have a resolution to approve the appointment of Deborah Deal to the Commission on Aging and Disability Services. Mr. Jansen, you have the floor.
Thank you. Deborah is here this evening. If the committee has any questions, her packet was submitted, gave an overview of her experience and her wanting to serve. So she's here tonight. If there's questions.
Thank you for being here, Ms. Deal. Any questions for Deborah Deal on the appointment to the Commission on Aging and Disability? You seem to have a lot of relevant experience. I was happy to see that when I read your application. So
Mhm.
I think she would be a nice addition
Absolutely.
to the committee.
I'll move we accept Deborah Deal.
Okay, we have a first
Second.
by Supervisor Nardigian, a second by Supervisor Robinson. All those in favor, say aye.
Aye.
Opposed? Motion carries. You have passed the first step, and now it will go before the actual entire board for a vote. Probably, I assume, in the next board meeting, whenever that is. It's the 15th.
15.
Yes, July 15th, Tuesday night would be Tuesday at 7:30. So I guess in 2 weeks from tonight. Yeah. So, do you have any questions? Did you have any? No?
No,
Oh.
but
Thank you for being.
if I could just sit here, can I do that?
Oh, yeah.
Oh, absolutely. Yeah.
Absolutely.
Yeah.
Yeah.
Yeah, no problems.
Good.
Okay, next, we have the 2026 budget update. I asked for this because I think it's important for the committee to hear in advance some of the things that we will be considering over the next couple of months as a lead into approving the budget. I know there are a lot of balls in the air still early, but anything that, you want to mention, good and bad, things that are looking good, things that, that aren't looking so good, let us know and we'll ask you questions at the end.
So yeah, we're here tonight to just once again to reiterate that this is very preliminary right now. So that some of these numbers, we do know, some it's our best guess at the time, and some I just attached some informational sheets in the packet that kind of give you overviews of some of the larger things that we'll talk about toward the end. So Rebecca and I are going to tag team on this, and she's going to start off with the Division of Aging and Disability Services.
So this is the one where we're not seeing the greatest impact, but I think it's important just to let you know what the impact is. So OAA Title III is the Older Americans Act Title III funding. So that's funding that we receive from the federal government through the Older Americans Act, passed down through the state and then passed on to us. The threes is just the act number. 3B, the reduction of approximately $2,046, that is for supportive services. So the budget that we received for that, or we received last year, was $128,500. So that'll be reduced by $2,046. We use that to support some in-home programs for our seniors. So again, Older Americans Act can only be spent on folks that are over the age of 60. So our Friendly Visitor Program, which is run by CAFASI, or Kenosha Area Family Aging Services, is funded through that. We have a small amount of money that goes to our Caregiver Support Program. And then we also, the biggest chunk of that money is we fund about $54,000 towards the Westosha Senior Center. So they do have a ton of great things out there, and it's certainly a worthwhile place for us to put some of these supported services dollars. The next category is C1. C1 is our senior dining program. That is about a $375,000 budget. So it's will be a loss of $3,000 towards that. That funds our congregate meal sites. We actually receive more money for senior dining than we do Meals on Wheels, which to me seems a little counterintuitive. However, the purpose of it is to encourage seniors to have socialization. So they put more money there. We are allowed to transfer a certain portion of that money if it's unused into Meals on Wheels, which we pretty much do every year. I think it's about $70,000 that we're allowed to transfer over. We do spend all of these monies. I mean, we don't end up with any type of money left over at the end of the day. These all go towards the programs that they're intended to do. So C2 with the reduction of $1,000 is Meals on Wheels. That also funds Village Pub, which actually is considered a carry-out site. So it's funded under Meals on Wheels. That's Village Pub is the one that's out in the Silver Lake area at the American Legion. That is probably our largest site for seniors to come. So it also funds that as well.
What's the total amount on that?
That is $127,000. And again, we're able to transfer money, so it ends up being a larger budget, but just to keep it straight and neat, we'll keep it in the buckets that it's really intended to be for. 3D, which is the reduction of $83, that is for health promotion. So that is for prevention programs and wellness programs for our seniors. So we have several evidence-based programs that we run, some on falls prevention, some related to nutrition. There's programs for people who are diabetics. There's just a variety of evidence-based programs that come through the Wisconsin Institute on Healthy Aging that we adopt and bring into our community. And we support that by the $12,300 that we receive to run that program.
And is that through Goodwill mostly?
That the person is stationed within the Aging and Disability Resource Center, but she is a Goodwill employee,
Yeah.
or the position is empty right now, so. And then the last one is 3E, which is, we got a $502 increase. That is for a program called NFCSP. That's the National Family Caregiver Support Program. And what that does is it provides, caregivers can apply to have like respite services come in the house, or if there's, in-home care that they need, transportation needs, something that can help the caregiver continue to be the caregiver for the person remaining in the home. That pot of money is used for that. That last year was $68,256. So we'll bump that up by $502 moving into the next.
3,000,
Yeah, we don't receive a ton of money to run these programs, as you can see. So all of the other allocations that we're aware of that the Aging and Disability Resource Center and the Aging and Disability Services receive so far have remained intact.
Come on.
Yes.
Come sit right here.
The doors were locked, so I couldn't get in.
Okay.
That's all right. Come have a seat.
That's all right. And then ignore the.
Are you Jeff?
Yes,
Yeah.
yes, okay.
It's
Ignore the email I just sent you.
just someone.
And then the only other change that you'll see in the budget is we had a pilot program for the state of Wisconsin for the last 2 years called the Independent Support Pilot Program, which is ILFP. That program ended on June 30th, so you will not see that returning into the 26 budget. So that's what we have for aging and disability. Are there any questions, comments?
How much was that pilot program?
It was a substantial amount over a period of 2 years. I want to say it was close to 300 and some thousand. Our target was to aid 500 consumers, and we we're still waiting since it just closed yesterday. We're still waiting for the final numbers, but we're somewhere in the high 480s, possibly 490s when all said and done. So we,
Why was it closed? 'Cause you're,
the state ended the funding.
okay.
Yeah, so the pilot ended, and whether or not the state will fund it in future years, who knows? It was a successful program our end, although it had some issues on the state level that consumers were not real happy with the way that some of the program was ran from the state side. A lot of people were able to get a lot of the services that they normally couldn't. These were the services that could pay for one-time things, like you could modify a van, you could purchase, we had a lot of people that purchased with sensory deficits that were able to purchase like equipment for their home. It was it could have been a really wonderful program, but there were a lot of glitches on the fiscal side from the state that we ran into some trouble with along the way. So I don't think it was.
Airlifts or something like that?
You could have bought chair lifts. Yeah, it was really wide open, but it was like one-time funding.
Right.
And the problem with it is although we received the money to run the program, we were not the fiscal provider. So if a client signed up for a service with, say, ABC wheelchairs, they would have to bill the fiscal side. And there was this very long delay and there were a lot of people upset and it became clunky when it shouldn't have been. So great in theory, and I would hope that someday it comes back. It needs to come back with some improvements, yes. So then the next one we have is our health department, and we again have,
Did you have a question?
oh,
Yeah.
sorry.
So I'm just wondering, do you have any numbers on how much of like our Division of Aging and Disability Services is federally funded or federal funds being run through the state?
I actually think I do, yes. So aging and disability is about an $8 million budget, or it was last year.
Okay,
About 5 million of that was federally based dollars.
okay,
2 million of that. Now, again, when we say federal dollars, that can be a pass through to us, but we go by where it's
Yeah.
originated. Right?
Okay.
So federal dollars, about 2 million in state. We had about 200,000 in grants, about 100,000 in client, funds. Now that can be people who've donated via Meals on Wheels or people that have given to our loan closet. So there's a wide expanse of ways that money came in. And then we had about 700,000 in levy.
okay.
That was a good question.
Thank you.
I'm gonna want to know that about everybody.
Yeah.
Well, I don't know.
Ultimately, we will, don't we?
Can I have a point of clarification on that? The 2 million that comes from the state, a lot of times there's federal money that goes to the state that then gets rolled through. How are you differentiating between
Right,
quote unquote state versus
right.
the pass through?
So, for example, the Aging and Disability Resource Center is funded from about 1.2 million from the state for a state contract.
Got it.
So we differentiate, like older
Okay.
Americans dollars, although they're federal dollars, they come through the state. We're still calling those federal dollars because
Got it.
that's where they
Okay.
originated.
Got it. Perfect. I just wanted to make sure. Thank you.
Sure.
The reductions don't seem to be that much relative to the total amounts too. They seem to be pretty small.
Yeah, they are. They are like
For this
a
one.
drop in the bucket for the budget that we have. The issue is we have an aging population. So these aren't really keeping, these decreases or lack of increases aren't really keeping up with the demand. So there's going to be problems. We were absolutely hoping for additional dollars to be able to serve more people and serve them better. And because, you can study after study shows that if we can support a person in their home with this amount of money, it saves us having to put them in a nursing home for this amount of money. But we're not there yet with this budget. So we'll continue to serve.
What would you expect, what would be the amount that you think would be sufficient to address the needs of?
Well, $127,000 for Meals on Wheels is a very, very small amount of money to be able to serve all of the people who need those nutritious meals. During the pandemic, we were very lucky, fortunate that there was a lot of extra money that was funneled through to provide those meals because we really wanted our seniors to stay home as much as they could. As that money stopped coming in or we weren't able to spend it, we've had to really cut back. And for a period of time, we actually had a waiting list for our Meals on Wheels because we had so many people that were in need, but we simply did not have the funding. Now we've gotten through that waiting list and we do not have any people on that waiting list anymore, but that was done by really adhering to the guidelines of Meals on Wheels, which was they had to be home-based. There were allowances for people to go to church and for people to go to their medical appointments. Where to me, that seems a little, I don't know if I consider that, my definition of homebound, I think is a little bit more, you know? If someone struggles with transportation, that to me is more homebound, but that's not how it's defined in the Older Americans Act. I also think too that we went back to kind of our one meal program, which is what Meals on Wheels really is. And although most of the time seniors can get 2 meals out of that one meal, we really liked the flexibility to provide some frozen meals for weekends and, you know, times when they're not receiving meals that we've had to cut back on substantially.
So all of these numbers are less than ideal then?
Correct.
Okay, okay. And
Yeah.
thus any reduction is a problem.
Right,
Okay.
right. But again, when you look at some of our other divisions, it's hard to complain about these when we're seeing some significant ones in other areas. So,
Right, right. Okay, thank you.
sure. Now, health, I'm not gonna do as well at, I'm just gonna tell you right now. So I didn't write down the funding programs on
No,
health.
it's okay.
The thing that's falling away.
Oh. So, again, there are some things still up in the air with health, but the ones that we do know is we know that our public health emergency preparedness funding, which funds our emergency preparedness person and her work, as well as our epidemiologist, that is going to be cut by 28% for 2026. We'll be able to employ both of those people. We'll just have to do some creative ways to be able to do that with that 28%.
You have to find money somewhere
We're
else.
going to, yes, yes. And we've got some plans to be able to do that.
Okay.
So our immunization budget has been cut by 50%. Now that is the nurse's time administering the immunizations. It's not the immunizations itself. So there will be less time in our clinic that will be able to be devoted to providing immunizations. Now, again, whether we have the funding or not, if somebody comes in the door, we're going to provide them with the immunization with the nurse. We won't be able to use the funds to offset the nurse's costs as much as we've been able to in the past. Public health infrastructure, this is a one-time funding that ends in 2027. So we have about a $78,000 decrease going into 2026. This has been a very wonderful pot of money for us to have because we've been able to fund some things that historically were underfunded, like our communicable disease team. You know, we're seeing more and more communicable diseases out there, in particular,
Thanks.
you know, some of the ones that you see, you know,
TB,
measles we haven't seen yet, but it's TB,
TB is
in
the one.
particular, that we always seem to have at least 1 or 2 people that we're monitoring for tuberculosis. And what that means is our nurses have to provide medications to them on a daily basis. So 7 days a week, the nurses have to go to the homes and provide that medication. So when you have only 3 people on that team, it's a hard team
And
to be able to keep ahead of some of the things.
at one point, we had 4 people that the nurses were having to go out to.
Right,
Um,
right.
And that can be anywhere in the county. So you've got somebody,
Yeah.
you know, driving out to the far west and then coming over here, and it can really take a ton of time.
Absolutely. So the infrastructure grant has allowed us to actually add a position into that communicable disease team, as well as some of our school nurses have stepped up and helped out, and we've been able to pay them for their time when the actual communicable disease nurses have been just overwhelmed with the amount of work. Like Supervisor Robinson said, when you have 4 people and you only have 4 nurses and you're doing 7 day a week, it can be tough for them to get the rest of their job done. So that decrease is going to have an impact. However, we knew about this impact, so we will be able to prepare for it to make sure that that team has what they need, even if we have to kind of shuffle the deck a little bit to work on that. In particular with, you know, measles on the horizons and who knows what's after that. That's a team that we really can't reduce or wouldn't want to reduce.
And really that decrease is related to the total sum that we were originally given. We were given over $400,000 in this infrastructure, and they said you have till 27 to spend it. So
It's just,
health departments across the
Okay.
state did different things with it. So we'll have 191,000 left. That's really what that means, which is you can see the reduction, but that's only because the money's starting to fade away.
That's spending.
Correct.
So then how do we fund that going forward? Because I assume we're gonna need to keep on top of communicable diseases.
We have,
We write for a lot of grants,
Okay,
is what we do.
health has probably over 60% of their budget is
Mhm.
grant related.
okay.
So there's my answer to your question.
We
I
hope that
don't
they're
have the
grant.
exact numbers in front of me, but we can share those in an email dollar wise,
Okay.
with the committee. So yeah, we'll continue to look at that. We have some current openings right now that we're not filling, pending what happens with other funding issues we're looking at in health. So we may be able to switch some folks into different positions, to keep those things, the key programs running, because we are required to have a communicable disease.
Yeah.
It's a state statute that the county has to provide that, or the health department has to provide that, so.
And then lastly, our SAMHSA grant that we've had for the last couple of years, that grant is actually ending at the end of September. What we have written for another grant to be able to take some of the good work that the SAMHSA team has done and hopefully employ a navigator to be able to continue some of the work such as the community education, the distribution of Narcan, as well as the, the teaching of Narcan, keeping the vending machines up and running, because certainly we see a lot of materials go out of those vending machines, as well as to do some follow-up on those EMS reports that we receive daily. That seems to be the place where we can make the most impact. Not necessarily, we won't have the capacity to probably see every person in person, but we can do some follow-ups to ensure that if they have resources that are necessary or needed, we can certainly provide those to them.
What is that grant? I mean, I know it's SAMHSA. What was the name of it?
Corey.
Yeah, Lori, okay.
So that is what we have for the Department of Health so far.
I'll switch to the Curie one, Children and Family Services, where you'll see some significant reductions. Just to point out, the 25 budget column is when we submit our budget, we always don't know what the allocation is at the time. So the very next column over is what the money actually was. So it was our, for example, kinship, we budgeted 108, we got 127,000. But looking at what we're hearing about for 26, and this is all very preliminary, you'll start seeing reductions in those funding sources. So kinship is, pays for our kinship worker and, the work that they do. And that's really based on the size of the work caseload at the time. So that's how the state's determining that funding. That memo that I attached, to the packet kind of explains the various funding things. So I'd ask that you take time to look at those. To link things up. Basic county allocation is dollars we get from the state that look to be pretty much the same going into what we're looking at for 26 at this point in time. Youth aids is a cut. Youth aids is dollars that we can use for kids that are delinquent. So it helps pay for services and if there's money left over at times placements. Targeted safety and support had a couple different funding sources in it. One is 4E dollars. 4E dollars are specifically earmarked for child welfare type work, and also had TANF dollars going into it. The 4E dollars have been removed. That's why you see the large reduction in kind of what we're looking at there. In order to address that, we're looking at probably combining a couple programs that do that type of work. Our BFI, which is our, Brighter Futures Initiative, is a state grant we have received forever, and we're not getting it anymore in 26. So that'll be a.
What was that programming?
That was programming a therapist over in the Times Bridges area. And well, also some of the work that the school liaisons were doing. So we'll look at trying to plug that. The positive parenting one, which is at 0, we knew that was going away. That was a grant. In fact, it's done now. So you won't see that moving forward in next year's budget. The community intervention programming it actually funds our intensive supervision youth comp programs for delinquent kids. Families First was also one-time funding. So we knew that was going away, and we'll jiggle things around best we can to deal with whatever hole that leaves. The Youth Innovation Grant, that's what we use for our countywide truancy program. And that was originally $100,000, then went down to 75, then 50, then 25. So we knew there was a step down for that funding every year. So what you see in that reduction, we are aware of and planning accordingly. And then last but not least is our foster family support. Grant, not grant. That is a competitive grant, and that was funding our One Hope program, which provided support to our foster parents. So at the time we did this, 2 days ago, it was 15. We found out yesterday, it's now down to $5,794. So a major reduction from $60,000 in that program. The other thing that I'd like to highlight that isn't on the sheet, but is about one placement cost that is going to skyrocket is our juvenile correction placements.
Okay.
Currently, we're spending $1,200 a day to send a child up to Lincoln Hills or Copper Lakes. The new rate, and it takes effect depending when the state passes the budget, if they continue this rate in there, will be $2,501,
Jeez, that seems.
which is a large increase. And then in 26, 27, because it's July to June calendar for them, it'll go up to $2,758. We've been averaging-
758?
Yes, a day. So we've been averaging roughly about 6 kids in corrections. So right now, our number is about 2.7 million. With this change in rate, that's gonna jump to 5.4 million for this year moving forward. And then in 26, 27, it would be $6 million, just to have 6 kids in corrections.
And again, these are not cases that our workers have control over. The judge orders where they go. So we have to pay for the placement regardless of whether we agree with the judicial decision to send a child to corrections.
Meanwhile, we're losing our Youth Innovation Grant and our other CIP programs that are working to help the kids and keep them from being in the
Correct.
system.
Have we seen that numbers pretty much stay around 6?
Yeah.
Yeah, it's been about 5 or 6 throughout the last 5 years. We average it out, yeah. Now, there's been some changes, there'll be some changes on the type of kid that corrections will accept. So first of all, we're supposed to look at the new facility that's opened up in Racine. And see if that's a consideration. Racine certainly can say yay or nay based on that kid's need level. And if that doesn't work, then unfortunately, we may end up in Lincoln Hills, but we're doing everything we can to stay out of that circle.
When's the Racine, like,
It's open,
oh, it is open.
yes. Yes, we have 3 kids there right now.
And what's different about that one? I mean,
It's a type 2 correctional facility, so the others are type 1. And it is run by Racine County, not the state. And it has a very strong treatment and education component that it will be better for kids if they need that level of care. But it's a locked facility.
It's a more intense.
I think more intense
Facility
treatment.
level 2 is then over level 1.
No, level 1 is the most
Level one's
intense.
more.
That's pretty much prison.
Oh,
So this is more of a
Security.
residential
treat.
correctional center. Yeah.
It's still locked. I mean, the kids are still in cells,
Yeah, right,
but they're able to be out and,
Yeah.
and actually have some skill development and treatment and programming, whereas in the correctional centers, they don't do as much of that.
I was talking to the county exec and she said that the 2 females that are there at Copper Lakes could be transferred possibly to Racine. Cause they take
No.
women as well as men.
Those, yes, they do have a adolescent girls program and boys program, adolescent boy program. The girls program has different parameters around it, and I don't believe that the ones in corrections would meet those parameters based on what we've been told by Racine and how they accept. So we aren't looking to transfer them, we're just looking to get them out.
Where would we take them if we can't put them?
Well, I mean, ultimately, corrections makes the decision on when these children are ready to.
Oh, you're saying get out and not.
Yeah.
Not go
Get out.
back in.
Yes, yes.
Thank you.
Yeah.
Get out on a larger picture.
Yeah.
But corrections controls that release date based on what that child's needs are and what services we can plug when he or she would come back to the community.
Well, what's the status on those 2, or?
I'm not sure where,
Placement possibly at Mendota for a temporary stay. She has pretty significant mental health needs that,
Okay.
probably have impacted her criminal behavior. So the wonderful thing about Mendota is we tend to be able to get kids out of there faster than corrections. It's not punitive, so that if they do things, it's, it's seen as a little bit more treatment focused than it is with that we're throwing you into lockup kind of a thing. So we're working on that. But again, a lot of those things we can push for them, but they are not We are dependent on others to accept them.
Not
to be able to do
guaranteed.
that, correct.
Is 18 the age that they go then juvenile?
17,
17.
yes.
So 17 then if they're, you know,
But if they're in a juvenile, if they're in a juvenile correctional facility and they turn 17, they stay in that facility. They don't transfer out to
they
adults
stay,
unless they were waived into the adult system, meaning they went through a court process that says, we're gonna treat you as an adult.
right, because I imagine that they were looked at as a child.
Yes, yes, Yep.
Okay, so they stay in until
Yep.
the time is up, they get, you know.
Mhm.
So
that's unusual, but yeah.
that is unusual,
Yeah.
okay.
And then
We're seen as a lesser cost than,
Racine,
Yes.
we bought,
Yeah.
we bought 2 beds at $1,000 a day. And then when we're past the 2-bed, it goes to 1,200 a day.
okay,
So we have 2 kids, we're paying $1,000 a day, and 1 we're paying 1,200,
Right.
okay.
but a significant reduction from the correctional.
So regarding Racine, we bought 2 beds, meaning we paid about, not that they're not gonna be used, but even if they're not used. we
Correct.
pay.
Correct. And the last thing related to DCFS that I alluded to is the John Elliott memo. He's with the Department of Children and Families, Division of Safety and Permanence, and it just kind of gives a paragraph about what each of these funding sources does and how they come up with the methodology of funding that I'm not going to
Mhm.
dive into and leave it for your reading pleasure. If you have questions after reading something, reach out.
What's the total in DCSF, the amount, the block that the allocator budget?
Well, right now, when we put this together, you're looking at a difference of about $987,000.
Right, I see it's about $1 million roughly, reduction.
And that's not counting that corrections. I did not talk about placements in that.
Okay,
That's just the program numbers that we're looking at.
but I mean, when you get the line item for all DCFS, what's the total amount for budgeted?
For budget, it's over,
35.
I'll have to.
Because I know it's a big chunk, the biggest chunk, isn't it?
Pretty high.
So if it's 30, all right, so 30 million or so, 35 million, okay,
Somewhere around there.
okay.
All right, and last, I just gave 2 white issue papers, I guess they call them now, from the Wisconsin County Human Services Association about larger things, Medicaid and the SNAP program.
Mhm.
This is changing so much, I'm sure
Yeah.
you could throw this in the shredder right now.
Yeah.
Because, but it just kind of gives you an overview of what would happen potentially if they stuck to one of the plans that was out there and floating around. For us, really, when we were looking at some of this, as they wrote some of those plans, they weren't going to take effect until 27, 28, maybe way out in 29. There was a fear certainly of people losing Medicaid coverage, which I believe is still out there. From a worker perspective here, if you start piling on all these other requirements, it's going to put more work on their plate, meaning we may need more staff to keep up with the requirements and what the state expects us. And what we should do is providing good customer service. So those are just for your reading pleasure. And that's kind of where we're at right now. We haven't really got any solid things on our behavioral health, so we didn't want to come in at this point in time. If anything pops, we certainly will make you guys aware of it and say, here's what we know right now. I believe the state's getting very close to passing their budget,
Yeah.
Yeah,
and the feds sound like they're not too far behind.
yeah, it has to go back to the House. And
Yeah, that could
so
be it.
there's that issue.
Yeah.
If there are any amendments made, then it's has to go back to the Senate,
Yeah.
so they're gonna have to agree, but more than likely it will pass.
Yeah.
Now, of course, that's the 1,000-pound gorilla in the room, the implications of the federal budget bill on Medicaid. I mean, I think the numbers were $800-900 billion cut. And it also, it's gonna impact Medicare too, and then all sorts of other implications. I mean, it's probably an impossible question to answer, but, is there any way to now, or to know what the impact might be for the county, or is that an impossible question to answer?
It's an impossible question to answer right now. They haven't drilled down to that level. I think everybody's just kind of doing a wait and see what happens, and then you'll start to see the numbers flying out, you know, so when we get something, I'll certainly.
Yeah,
pass
please
that
keep
along.
us addressed, because, you know, if it, if it takes a long time, like you know, these things do. I mean, we have to pass a budget
Right.
in a couple months. And, if it's contingent, 60% of our budget, human services budget, is based on grants, federal and state. That's an enormous amount of money to adjust the last minute. I mean, I would hate to be doing a budget on this now under these circumstances. But, yeah, keep us informed
Have
as to.
planned A, B, C, and D.
Okay, good.
That's what I wanted to know.
John,
I have a feeling you're gonna need A, B, C, and D. Yeah,
they're professionals, don't try this at home.
I know. I'm glad you're doing it. Oh,
You know,
anyway,
certainly prioritizing what's mandated for us to do. You know, certainly we
yeah.
have to prioritize that. And then we'll start, if cuts come, we'll have to look at those programs that are not mandated. And that's really unfortunate. But
Yeah.
And we certainly want the committee and the board to know that if you're going to take this away, or we're gonna have that reduction in funding, guess what? You're now going to create waiting lists
Yeah.
or other issues down the road, you know, that.
right.
I think everyone on this committee is familiar with about.
Or
She was next. Yeah, Supervisor Kirby.
Oh, I was gonna say, so I was thinking, just like in the case of the care center, like that's a program that saves us money.
Mhm.
It's not required, but it actually saves us money.
Correct.
And I'm assuming you guys have those kind of like, here are the ones where we actually save money with this. We want to keep funding this.
Absolutely, absolutely.
Supervisor Brown.
And yeah, I sort of want to piggyback on that, because I know there are things that have to be done, and then there are things that we as a community are used to having been done. And the cost savings of sharing that with the safety net of the nonprofits is vital. And I've explained it, so I'm going to use Women and Children's Horizons as an example. If we give them $50,000 for their children's program, I think that was a number floating around last year or something. If we give them $50,000 for their children's program, and then that gets cut, even if it only gets cut $10,000, if it gets taken away, it doesn't just affect the children's
No,
program.
absolutely not.
It affects the entire agency. And
Sure.
even though there's not a county requirement to have a shelter for victims of domestic abuse and their child witnesses, it still affects our community. And so that $10,000 coming off of the 50,000 affects their infrastructure. Yeah, you know,
Yeah.
they're doing exactly what they're supposed to be doing, but one of the things is answering phones. Well, children's programming needs phones answered, right? And so if you take away that $10,000, that affects the phones being answered too. So I think it's such an important pool of money that it's not just the county's money. It's not just, you know, our money. It's looking at how our safety net affects the entire community.
Absolutely.
It's true. Supervisor Robinson.
One of the things that I would like you to pass along is that we're really gonna need to be looking at what's happening with Brookside and
Mhm.
Willowbrook. Because if the Medicaid funding gets cut, you know, many seniors are having their nursing home care taken care of by Medicaid. And so we need to make sure that, you know, that is going to also have a cascading effect, because it's not just the individual who is not receiving it. That individual has to be taken care of somewhere,
Someone.
which will end up going probably back to family, which means that the family then, somebody's not going to be able to work. And, you know, there's this whole cascade. Meanwhile, you've also got employees
Yep.
at Brookside and Willowbrook who
Yep.
may or may not have other,
Reduction in force.
yeah, other people, yeah. So I'm very concerned about where our seniors are gonna be going. And, so again, we don't know right now. Too many numbers have been floated too many different directions, but as soon as anybody gets some sort of an idea, if we can start getting information, that would be really helpful. Thank you.
Absolutely.
Supervisor Nordhagen.
Thank you, Chair. The cuts that they're being talked about, whether that's the way they're gonna be or they're not,
Right, we don't know.
that's all we know. So I
Right.
think we're kind of getting the cart in front of the horse here, and let's see what comes out, what comes through the state, what comes to us, and we'll deal with it at that time. But I think all of what you've said make all the sense in the world if it ends up going that route. I hope it doesn't,
Mhm.
but you know, let's
Right.
Yeah.
not lose sleep over it right now.
I like to set up my plan A, B, C, and D. Okay, I like my plan.
Give me like,
That's
one of the
my
things I
worst
enjoy
case.
doing is
Let me get
the
the-
financial modeling. stuff.
Yeah.
Let's see what comes out.
Yeah.
We certainly appreciate your support.
Yes.
Yeah, thank you. Well, I want to get more money out to the Sharing Center.
Well,
I'm just-
I was, I
We don't
was
disagree with.
Supervisor Robinson, we got a whopping $502 for that family need home care. That'll solve our reduction in force problems. No, I'm kidding, I'm kidding.
All right.
I think that was
Um,
insurance
you-
increase that we are
Do
gonna.
you have
pay.
anything more?
We're done.
You're done? Any other questions? Becca or John? Okay, well, thank you for your input. I'm sure we'll be asking you questions. And please inform us of anything new that comes up. And especially with these grants that we're waiting on and hoping for, so. All right, I think that's it.
Move to adjourn?
Move to adjourn. Okay, we have a first for Supervisor Cardigan, second by Supervisor Nez. All those in favor?
Hi.
Bye.
Opposed? Okay, we
Hey,
are
if you ask
adjourned.